Hi, I'm Mary with Miles for Hips. I'm speaking with Haley about her experience as an adult hip patient with hip dysplasia. Haley, thank you so much for taking the time to answer some questions for us. So, to start us off, can you tell me what it's like to receive a hip dysplasia diagnosis as an adult?
Um, it was shocking originally. I remember just being kind of flabbergasted. I was 25 and was competing in Olympic weightlifting at the time and very active. I was a grad student and I'd had some, kind of hip pain. It was just weird symptoms. I noticed the symptoms of a labral tear and went in to a surgeon, just expected that. I had a labral tear. I knew many other weightlifters that did. And he took one look at my x-rays and said, "Has anyone ever told you that you have hip dysplasia?" And I just remember going, that's what babies and dogs get. I knew about it in babies and dogs, but I had never known an adult that was diagnosed. And so I kind of remember just being like, how could I not have known that? And he brought up the idea of a periacetabular osteotomy, just kind of very briefly. And I just said, no way, this is crazy. And so I basically just needed some time to sit on it and think about it and try physical therapy and changing my activity. And while I also did a lot of research and reading and found a great Facebook group, other adult patients, and learning more about it before I kind of was willing to consider surgery or anything like that. But yeah, I remember feeling very lost. It was, I didn't know anyone in my life that had ever dealt with it.
Yeah, it's tough to hear, and it's nice to find, the group, the sort of community that helps seems to help everybody a lot. Um, what do you wish that others knew about hip dysplasia?
I think that I'd like for more people to be aware of dysplasia as something that isn't just in babies. I think obviously we need more awareness of that, but it is screened for severe dysplasia in very young kids. But I think a big part of that is just knowing that it is a common issue, especially in women, that hip pain in young adult, teenage to adult women, especially, and men should always be screened for dysplasia. I know I got very lucky that the first hip surgeon I saw, who was a hip scope specialist, caught the dysplasia and referred me out immediately. But I also have met plenty of patients who have gone years before they were diagnosed correctly. And so I was fortunate in that respect, but I do wish people knew more about it just so that it could be caught. I think people spend a lot of years in pain that they don't need to because of that. And I think I also wish that there was more awareness, more coordination between surgeons and physical therapists of all of the effects of dysplasia, and especially for people who aren't diagnosed until adulthood, how many muscular issues that people might have, all of the things that our bodies naturally do so impressively to compensate for that dysplasia. And it can make rehab from surgery very difficult. It can make it a long process, but it also, kind of being aware of that side of things, I think can improve surgical outcomes as well. And for some people, a periacetabular osteotomy, PAO, is not a good option. They can see improvement for symptoms with more focus on activity modification and physical therapy, but it needs to be the right way. So just going in and doing some exercises often isn't the fix. People are just doing exercises that they downloaded offline. It's not a one size fits all thing, and they need to be able to really get with someone who knows what they're doing. And I think I wish people understood the scope of the surgery and the recoveries. That was something that I had a really hard time with people around me that hadn't gone through it, understanding. And so I think partially just because it's not a very common surgery, it's not something that many people have heard of. And so I found myself often in recovery having to explain why things are taking so long.
Yeah.
Do something at a certain time. And that was tough.
Yeah, there's so much to it. That's true. So another question we had was, what have been some of the most valuable resources for you during your hip dysplasia journey? And are there any additional resources that would be helpful for patients that aren't currently available?
Probably the single biggest thing was I did find a fantastic Facebook group that's continued to grow, full of people at all different stages. They've just been diagnosed or have surgery scheduled and are planning, or early in recovery or years down the road. And now I've passed through all of those groups over the years. I started out when I was first diagnosed, and now I am 7 years past my first surgery. And it's been a fantastic resource of people that can help provide firsthand experience with technical, the logistical things. This is the product I found most helpful, or here's how to pick something up off the floor safely after surgery, to just having people around that can say, yeah, that part was really rough. It gets better. And so that's been a huge, huge support. And I've tried to stick around and give back, which I know a lot of other patients do as well. I can get to now talk to people and remember being back in that early diagnosis where I'm just going, what? What do I do? Like, what do you mean I need to go find a specialist in this thing? And it's nice to be able to maybe make that phase a little less scary for other people, just like others did for me. So that was a huge thing. I did a lot of research, and I think one of the things that Miles for Hips has worked on really hard that would have been a huge help is having a good set of documents that kind of helped you understand what was being discussed, what you were reading, some of the terminology, some of the angles that doctors will talk about and what they're looking at imaging and the types of surgeries. And I had to do a lot of digging and kind of finding things from all over the place. But I think that sort of resource is really important to help patients be able to navigate the process well, to advocate for themselves, to ask the right questions. We've all had that experience of sitting in a doctor's appointment and feeling like they might be talking a different language. And
Yeah.
and you don't even know where to start with asking questions. So having, that resource to be able to understand, kind of get a basic dictionary of what was being talked about, so that I could ask all of the right questions, and felt like I could find a surgeon that was the right choice, could make an informed decision about surgery. And Miles for Hips has continued to build that, and I think that's a really important thing for patients. And also having more stories of patients that were like me. I was in my 20s, I was very active, and I wanted to return to that. I wanted to be able to go back to weightlifting and backpacking. And so I didn't have a great set of resources for that at the time. Fortunately, I was able to find some patients that were like that. And obviously reading a big variety of stories was helpful, but being able to find more patients like me would have been really helpful. And, for some patients that'll look different. For me, I didn't have a long history of decades of pain or failed surgeries or anything like that, misdiagnosis. For other people, that is something they need to hear. They need to be able to reach out to people who had complications or recoveries that didn't go the way they wanted. And I think having more resources to be able to connect with other patients would have been really helpful. And then I think the other big resource for me was my great physical therapists. But I know from talking to a lot of patients that often patients have a hard time, and even physical therapists have a hard time finding information about dysplasia and recovery from these surgeries or prehab before surgeries. And I think building that as a resource, both for patients and for physical therapists, so that they can learn more about how to effectively work with these patients would be a great resource that would help a lot of people.
Yeah, those are all great resources and great ideas. And regarding the stories, I'm hearing more and more about how people find those valuable to connect with. And like you said, finding the stories that you connect with personally. Not everybody's coming from the same direction and same background. So the more people that share their stories, the more who are going to find someone that they connect with. So it's really important that people continue to share theirs. What are some of the silver linings that have come out of your hip dysplasia journey? And what are some of the things that you have learned about yourself through your hip dysplasia journey?
There have been some great things. My surgery and recoveries were tough, but now one of the benefits of being several years down the road is that I look back on them and I really did learn a lot. They were like most difficult things in life, big learning experience and growth opportunities. The first one was about asking for help and accepting help when it was offered. I've always been someone that had a hard time with that, and I was very independent. And so it was really tough for me to need to say, I need help with this, or one of the really hard ones was after surgery asking for things that weren't true necessities in the strictest sense of the word, like being able to call up my friends and say, I'm feeling really lonely, stuck at home right now because I can't get out as much. Can you come over and have a movie night? And that was a really, really tough thing for me to do. But I learned to do it. And I had a lot of practice asking for very specific things. I remember with my second surgery, I asked a friend to go ahead and set up a meal train and gave her the emails and phone numbers to send it out for my coworkers and friends and family, so that they could set up a schedule for people to bring dinners. And I had to ask for that specific thing and not wait for someone to offer it. But once I did, there were plenty of people happy to help. They just didn't know how. And so, learning kind of that lesson of being able to articulate what I needed and ask for it. And then when people offered, taking them up on it. And sometimes that was really hard too. And that I didn't need to always be as independent as I possibly could be. It was okay to accept help and to kind of let people in on that. And I think ultimately I learned that actually built relationships with people. I realized, I enjoy helping my friends and neighbors. That's something that feels good to me. And I feel more connected to people when I can do that for them. We can take turns. So it was a good opportunity for me to really kind of get over that fear and that discomfort. And I think I came out with some stronger friendships and also more awareness of other people who may be struggling to ask for help and not feel, understanding how hard that can be. And it's helped at times where I think I can kind of see someone and say, how about I do this specific thing and find ways to make it easier for someone to take me up on that offer. And the other kind of big thing was I learned how to live my life and find joy and richness in my days, no matter where my body was at. Instead of putting my life on hold for a few months for recoveries, I just decided that life would look different, and that's okay. And there were plenty of things that I might not be able to do. Hiking is one of my favorite weekend activities. I couldn't spend 7 hours on a Sunday going for a nice long hike. But it was a good opportunity to take a daytime class at my church that I normally would never get to take because I was always working, or join a book club. And I found ways to get out of the house and did things during the day, like just have someone drop me off at the local coffee shop and I'd sit in an armchair with my feet up and get to know some of the regulars during the day. And, meet people that I wouldn't normally see because I would normally be rushing through the drive-thru for coffee in the mornings. And I think that was really important for me, to realize that my enjoyment of life didn't depend on my physical abilities. And I think that's something that I've carried through with me with, other injuries or physical health challenges that kind of will always be a lesson. And it's made me more aware of other people and people who may be struggling with chronic illnesses or physical disabilities, and things that can make our world more inclusive and help people to, engage. I was never terribly aware of, handicap accessibility out in public. And now I really am, and what things make a building or a physical location accessible to more people. So I think that was a big lesson as I tried to find ways to keep going about my life on crutches, or when I was just off crutches and couldn't walk very far. And I had some experience having what was effectively an invisible disability once I was further along in recovery and wasn't using crutches, so there wasn't a visual indicator, but I still wasn't fully recovered. And I kind of learned about that side of the world. And so I think that was a huge lesson for me, was just having some experience, finding a way to thrive and go about my daily life with a temporary difference in my body and what I was able to do.
I think that will resonate a lot with a lot of people, actually, with having trouble slowing down and really taking time for themselves and having to ask for help. I see that a lot. You know, being really hesitant with that and just having to accept the help. So a
It's
lot of
tough.
people find that tough. I know that I did too.
Mm-hmm. And one of the big parts of that was learning that rest is productive, mm-hmm. and there's no such thing as doing nothing. You're always doing something.
Healing, right?
And I think it's something a lot of us struggle with. We say in this day and age, I don't know if it's actually changed or not, but a lot of us feel like we need to be going constantly.
Right.
We need to be incredibly busy, and it was a different pace, but I found that didn't mean that I wasn't doing anything.
And I have to accept it.
And I could enjoy having more time, just to, have days that were free where I could read or I could watch TV. That's all right. Like, I don't need to feel guilty about that. I think it's something a lot of people struggle with, but, and it was not always something that I enjoyed about recovery. There are plenty of days where I was frustrated and impatient and just wanted to go back to normal. I didn't want to deal with this. Mm-hmm. In the moment, there were absolutely plenty of those days. But, I got through them. and it did pass. So I can look back and I remember those, early weeks felt so slow and so long. And, one of the nice things about having gone all the way through the process is you can think about that in hindsight and remember, what seemed like it was taking forever at the time doesn't seem like it took that long now.
Right.
And, everything kind of looks a little different in the moment. And that doesn't mean it's not a very valid struggle or that it doesn't really, really stink at the time.
True. So I have one more question for you. What advice would you have for someone who was recently diagnosed with hip dysplasia?
That's a tough one. I think the biggest thing is that there isn't one right way to go about things. There isn't one right path. There isn't one perfect recovery. There isn't one good choice. And everyone needs to kind of look at their own situation in life and where they are, their priorities, and find a care team, a surgeon, physical therapist, your primary doctor, your family or friends that will be helping you at home who are there to support you making the best decisions for you. And I think that was a really important part of taking control of my experience as a patient. And that, it's important to, as a patient, put yourself as the captain of the team. And everyone else has their areas of expertise, but they're there to support you getting to where you want to be. And that may look different for everybody. And recoveries are going to have different challenges, and it's always going to be different for everyone. So just stay focused on you, and try not to be sitting there comparing yourself to other people. Don't feel like because someone else made a choice that that's what you need to do. And yeah, approach doctor's appointments with that thought in mind. You're there looking for someone to help you get where you want to be and help you make the best decision for you. And always kind of keep that in mind. And and think about all of the people that you are seeing, all of these experts, as the team that you're putting together around you. And you're not a passenger in the ride. You are in charge of it. There are going to be things that you can't control, but you're still the one navigating. So I think that's probably the best thing I can come up with. And and there are going to be things that you can't control. There are going to be unknowns, and they're scary. And it's okay for those to be things that make you anxious. And unfortunately, there's no way to really get rid of those in life. I mean, there's always going to be unknowns, but that's a big part of the dysplasia journey for a lot of people. It's something that's very scary. And just know that that's normal. It's normal to be anxious or worried or feel like you wish you knew how things would come out so that you can make a better decision. I mean, if only we could all see the future, it would make our lives a lot easier. And I think just, know that I think most of us have felt that way. And that you can get through it.
I like it. Thank you so much for taking the time to speak with me today. I really, really appreciate it. I appreciate all your thoughts and answers. And that's all I have. Those are all the questions I have for you. Thanks again.
My pleasure. Thank you so much for all the work you're doing with Miles for Hips. And I really appreciate it. I know there's dysplasia patients, past and future, and caregivers that will always won't know how many people it helps. So, I appreciate it.